Here's the conclusion of the paper. Just as environmental scientists describe the health of the Earth as the capacity of a complex system to maintain a stable environment within a relatively narrow range, we propose the formulation of health as the ability to adapt and to self-manage.
Welcome to Build Beyond, a podcast designed to challenge and guide you on your health journey so that you can meet your full potential.
During this episode, I'll discuss the definition of health by reviewing an article calling for a change in the definition created by the World Health Organization. But before I start talking about health, I need to acknowledge that words have meaning. The words we use can affect healthcare choices and healthcare outcomes. Here are some examples of the power of words from a chiropractic perspective. Many people are told that they have things like degenerative joint disease or degenerative disc disease, and it's just based on casual observations of x-rays. Now, these degenerative changes seen on x-rays may be completely normal, and they're not necessarily signs of abnormal aging. But when healthcare providers use scary words while showing their patients the x-rays, people tend to react with fear, and they often avoid activities that they enjoy and some activities that may actually help them manage their pain and improve their health. For example, telling someone that they have a degenerative disc disease or a degenerative joint disease and that their joints are progressing to bone on bone. That sounds scary. Telling someone they have bone spurs, it sounds scary. If you're in pain and your doctor tells you that your joints are bone on bone with bone spurs, the image in your mind may be of bones grinding on each other while you have like sharp, bony shards that are jabbing into healthy tissue every time you move. The result of these words is often fear of movement and avoidance of activity, which can create disability. Instead of using scary words, here's an explanation of similar x-rays using different words. You could say, your x-rays show some signs of normal aging that may not even be contributing to your pain. And this is great news. There's a lot that we can do to help you manage your pain and get you back to the things that you need to be able to do and the things that you enjoy. So here are some more specific examples that I've dealt with in practice. One time I had a parent come in and he brought in his young son, maybe 12 to 14 years old. The boy had started to have some low back pain. He was a fairly competitive athlete for his age. He was growing rapidly, was starting to put on some muscle mass. His dad was concerned about the low back pain because the father had been diagnosed, correctly or incorrectly, I don't know, with degenerative disc disease at some point in his life. He had also been told that it is hereditary and that there is some potential of passing it on to his kids. And now that his son, at a very young age, was complaining of some of the symptoms that he had experienced, he was visibly upset and very afraid that his son was starting to develop this disease. The son, as a typical 12-year-old, did not look distressed and described his low back pain as just kind of annoying. Now, did the dad actually have degenerative disc disease? I don't know. He wasn't my patient. Let's just assume that he did. And is there some type of hereditary component? Could he have passed it on to his son? Yeah, possibly. Was his son exhibiting early signs of degenerative disc disease? Probably not, but it doesn't really matter. That the father's reaction to this was over the top. And I don't blame him for that. But he didn't understand the diagnosis and he didn't understand the disease. So the words that were used were creating some type of fear response for him. And another example that I see commonly is when people are casually diagnosed with scoliosis. And now because of digital x-rays and smartphones, a lot of times people carry those x-rays around with them. To have a diagnosis of scoliosis, there are some specific measurements that have to be taken. And a lot of times what happens is people will see an S curvature, a slight S curvature, and they'll just say, oh, it looks like you have some scoliosis. And when people hear the word scoliosis, they think different things. And a lot of people are going to carry that diagnosis and those words around with them. And it almost becomes part of their identity. Now they are a person with scoliosis. They're a scoliosis person. And they will they feel like any ache or pain or anything that's going on in life is probably related to their spine. A lot of them are very quick to seek health care for things that are probably normal aches and pains because they feel like maybe their spine is getting worse. So this is an example of how using uh, a term like scoliosis, which is an actual diagnosis, if you use it incorrectly, or even if the person has scoliosis, not explaining what that means, because there are a lot of people with quote unquote abnormal curvatures of their spine that don't really have a lot of back pain. And there are people with a ton of back pain who have really fairly normal curvatures of their spine. So they're not it's not necessarily a cause or effect. Another thing that's quite common to hear as a chiropractor is people being told that their spine slips out of alignment. So they have back pain and they're saying, my back is out. Now I understand where these terms came from historically. And I understand that it's just common terminology at this point. And I don't think healthcare providers that use this terminology are necessarily trying to deceive anyone. But the visual that a patient gets is that their spine is actually moved out of alignment. And because of those words, they will go seek chiropractic care, for example, and they will want their spine put back in alignment. And they don't seem to understand that that's not possible. And if it was possible, it would actually be a medical emergency. You wouldn't need a chiropractor. You would need to be spine boarded and taken to the emergency room because that's an unstable spine. So these are just some examples of how words have meaning, and the words that we choose actually affect the way we see ourselves. They affect the way that we select healthcare, or at least the quantity of healthcare, maybe the type of healthcare, and they can affect the outcomes of healthcare. Now I'd like to discuss an article. The title of this article is How Should We Define Health? This was published in the British Medical Journal in 2011. The content of this podcast is a combination of information and opinions from the article combined with my own opinions. If this topic interests you, I highly recommend reading the article for yourself. It's only 2 pages long, and I'll include a link in the description. The article starts off by talking about the World Health Organization's definition of health, which was created in 1948. And it says that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The authors note that in 1948, this definition was groundbreaking because it overcame the negative definition of health as just merely being the absence of disease, and it also included physical, mental, and social consideration. But as people and environments start to change, and the pattern of illness changes, this definition may become counterproductive. So this article attempts to describe the limitations of the WHO's definition, and then the authors offer some suggestions for improving the definition. These proposed changes were developed at a conference of international health experts. I'm not sure what kind, they didn't really go into details, but international health experts, and it took place in the Netherlands. So let's start off with what the authors thought about the World Health Organization's definition. What are the limitations of this definition created in 1948? Most of the criticism concerns the absoluteness of the word complete in relation to well-being. The first problem is that this definition may unintentionally contribute to the medicalization of society. The requirement of complete health would leave most of us unhealthy most of the time, according to the authors. It may therefore support the tendencies of the medical technology and the drug industries in association with certain professional organizations to start to redefine diseases, expanding the scope of healthcare and the healthcare system. So new screening technologies may detect abnormalities at a level that may never actually cause illness. And pharmaceutical companies may be tempted to produce drugs for conditions that were not previously defined as health problems. If this occurs, the thresholds for intervention may be lowered. For example, with blood pressure, cholesterol, and blood sugar. An emphasis on complete physical well-being could lead to large groups of people becoming eligible for screening for expensive medical treatments. This is a slippery slope argument, which is honestly not too far-fetched. I'm not going to put on a tinfoil hat and start spreading conspiracy theories, but there's a lot of money to be made in healthcare. And if we start to classify people as unhealthy, and then therefore we can justify additional diagnostic testing, medication, and other therapies, there's more money to be made. And this isn't meant to be a low blow to the medical community, because we have similar tendencies in the complementary and alternative healthcare space as well. The second problem with this definition is that since 1948, the demographics and the nature of disease have changed a lot. In 1948, acute diseases like infections presented the main burden of illness, and then chronic diseases like heart disease simply led to early death. In that context, the WHO's definition of health was more appropriate, but these disease patterns have changed. Public health measures have improved nutrition, hygiene, and sanitation. We also have more effective healthcare options. As a result, the number of people living with chronic diseases has been increasing. Aging with chronic illness has become normal, and chronic diseases account for most of the expenditures of the healthcare system, putting pressure on sustainability of the healthcare system. In this context, the WHO definition becomes counterproductive because it declares people with chronic diseases and disabilities definitively unhealthy. It minimizes our ability to cope with physical, emotional, and social challenges. The WHO definition also doesn't acknowledge our capacity to thrive. And by that, they're talking about having fulfillment and a feeling of well-being, while simultaneously living with a chronic disease or disability. The third problem that the authors point out is that the definition is impractical because complete is not necessarily measurable. It's not measurable because we have numerous systems to classify diseases and describe aspects of health and disability and functioning and quality of life. And these classification systems can be complex and contradictory. So the authors support moving from a present static formulation towards a more dynamic definition. Therefore, they recommend using this verbiage: the ability to adapt and self-manage. If we're going to consider health as the ability to adapt and self-manage, then we need to talk about at least 3 different domains of health: physical, mental, and social. Let's start with physical health. When confronted with any type of stress, a healthy human should be able to respond and protect themselves. So what does it mean to protect oneself? Protecting oneself is the ability to reduce the potential threat and then to restore some type of equilibrium or baseline health. And if this coping strategy is not successful, then the damage would remain, which may finally result in some type of illness or disability. For mental health, we need to be able to cope with a wide variety of physical stresses. We need to be able to recover from strong psychological stress, and we have to prevent post-traumatic stress disorders. We need to be able to understand, manage, and find meaningfulness when dealing with difficult situations. So a strengthening capacity to adapt and to manage yourself often improves feelings of well-being and may result in a positive interaction between the mind and the body. Lastly, we move on to social health. There are several aspects of health that can be highlighted in the social domain, including the capacity to fulfill your own potential and your obligations, the ability to manage your life with some degree of independence despite your medical conditions or your disabilities, and the ability to participate in social activities, including work. According to the authors, social health can be considered a balance between opportunities and limitations. We need to consider the effect of dynamic external forces like social interactions and environmental challenges. Successfully adapting to an illness or a disability would require that someone is able to work or participate in social activities and feel healthy despite any limitation. How do we measure health? A general concept of health is useful for management and for policymaking. Focusing on general health can also support healthcare providers in our daily communication with patients because it focuses on empowerment of the patient. For example, by changing a lifestyle, which a doctor can explain instead of just treating symptoms. However, if you can't measure something, it's hard to manage it. Therefore, clear definitions are needed for measurement purposes, research, and just evaluating the effectiveness of treatment. According to the authors, any measurement instruments should relate to health as the ability to adapt and to self-manage. We do already have some good initial tools that include methods for assessing functional status and for measuring quality of life and sense of well-being. The World Health Organization also has developed several classification systems that measure the degree of health. These assess aspects like disability, functioning, and then perceived quality of life and well-being. However, there are few methods for measuring aspects of health like an individual's capacity to cope and to adapt or to measure the strength of a person's physiological resilience. So, a new definition of health could stimulate research pertaining to the development of better methods for objectively measuring all these different aspects of health. Here's the conclusion of the paper. Just as environmental scientists describe the health of the earth as the capacity of a complex system to maintain a stable environment within a relatively narrow range, we propose the formulation of health as the ability to adapt and to self manage.